USMLE type question, cystitis, due to Escherichia coli. A 25-year-old woman presents with dysuria, increased urinary frequency, and suprapubic pain for the past 2 days. She denies fever, flank pain, or vaginal discharge. She has no significant medical history but reports frequent sexual activity. Urinalysis shows pyuria and bacteriuria, and urine culture grows lactose-fermenting, gram-negative rods. Which of the following virulence factors is most responsible for the ability of this organism to colonize the bladder? A. Capsular K antigen, B. Lipopolysaccharide LPS, C. P. Fimbriae, D. Shiga-like toxin, E. Urease production. Answer and explanation. The correct answer lies the bladder. Key clues for USMLE thinking. Dysuria, frequency, suprapubic pain suggests acute cystitis. No fever or flank pain, less likely to be pyelonephritis. Lactose-fermenting gram-negative rods, characteristic of Escherichia coli. Frequent sexual activity, increases risk of urinary tract infections, UTIs. Why P. Fimbriae? E. coli causes 80 to 90% of UTIs. P. Fimbriae, P. pili facilitate attachment to uroepithelial cells, allowing E. coli to colonize the bladder and ascend the urinary tract. Why not the other options? A. Capsular K antigen helps E. coli evade the immune system but is more important in neonatal meningitis. B. Lipopolysaccharide LPS causes septic shock in gram-negative bacteremia not directly related to bladder colonization. D. Shiga-like toxin found in enterohemorrhagic E. coli (EHEC) causing blooduria, not UTIs. E. Urease production seen in Proteus species, not E. coli. Urease alkalinizes urine and promotes struvite stone formation. USMLE type question, pyelonephritis. Due to Escherichia coli, a 32-year-old pregnant woman presents with fever, chills, nausea, and right-sided flank pain for the past 2 days. She also reports burning urination and urinary urgency for the past week. Physical exam reveals costovertebral angle tenderness on the right. Urinalysis shows WBC casts, pyuria, and bacteriuria. Urine culture grows motile, lactose-fermenting, gram-negative rods. Which of the following is the most likely pathophysiologic mechanism leading to this patient's condition? A. Hematogenous spread from a distant site. B. Bacterial ascent from the lower urinary tract. C. Direct invasion through a gastrointestinal fistula. D. Bacterial biofilm formation on urinary catheters. E. Person-to-person transmission via fecal-oral route. Answer and explanation. The correct answer is B. Bacterial ascent from the lower urinary tract. Key clues for USMLE thinking. Fever, chills, nausea, flank pain suggests pyelonephritis, upper UTI, burning urination, urgency, prior lower UTI, cystitis that progressed. Costovertebral angle tenderness, classic finding for pyelonephritis. WBC casts on urinalysis, kidney involvement, diagnostic of pyelonephritis. Lactose-fermenting, motile, gram-negative rods suggests E. coli. Why bacterial ascent? Most common route, E. coli ascends from the urethra, bladder, ureters, kidneys. Risk factors, pregnancy, female anatomy, vesicoureteral reflux, VUR. Why not the other options? A. Hematogenous spread, rare in UTIs, more common in Staphylococcus aureus bacteremia. C. Direct invasion through a GI fistula, seen in Crohn's disease, not typical for UTIs. D. Bacterial biofilm formation on catheters, occurs in catheter-associated UTIs, but no catheter history here. E. Fecal-oral transmission, more relevant to GI infections, e.g. Shigella, Salmonella, norovirus, not UTIs. Would you like more UTI-related